So welcome Platinum Dermatology to Cosmetic Laser Dermatology out in San Diego, California. Thank you, Dr. Goldman, for hosting this exciting conversation. We're here today with a really exciting group to talk skincare, which obviously there's a huge push with skincare sales and skincare knowledge and just training overall on skincare across the organization. As the Aesthetic Research Committee, two members that we have with us today, really are leading the efforts for our company to have a strategic push both in office and with e-commerce with bestderm.com. So today we thought it would be great to give some really behind the scenes information on a really exciting product that we're going to have featured on bestderm.com with actually the founders. So Dr. Sophie Bai is joining us today from Pavise, and we are really excited just to talk skincare because, again, I think, you know, when we talk to our providers and our providers talk to our patients, we all know in dermatology how important sunscreen is every time you leave your house and even in your house, right? So today we're just going to talk a little bit about skincare because we think just knowledge is power when it comes to new innovations in this space, and we have a new innovator in the space with us today. Dr. Bai.
Well, thank you, Chris, and thank you, Dr. Goldman, Dr. Bowers, to be here with us. So my name is Sophie Bai. I'm a chemical engineer trained at MIT and Harvard, was previously a cancer drug developer for prostate cancer. Skin has always been a passion of mine because I have acne and eczema, never had good skin growing up, and was bullied because of it. And that's why now I'm in this field because I see so much innovation in oncology, immunology, cardiovascular. But look at dermatology, we still use retinol, which was discovered in 1906 as a gold standard in the therapeutic area. So we want to change that. We really want to bring the new innovation, serious innovations to the field where I believe everybody is a patient. I'm so excited to introduce Dr. Goldman, Dr. Bowers. So let's start with Dr. Goldman. You are probably the most famous person, or one of the most famous persons I know. So why don't you tell the audience, a little bit about yourself?
Okay, just in a few words. So in 1986, I graduated from UCLA in my dermatology residency. I did my med school at Stanford, and while in school, I developed a real passion for dermatology because in the olden days, dermatology was not thought of as a really intelligent specialty. We basically wet things if they were dry, and we dried things if they were wet. And then I could see the future in the immunological advances in dermatology, being at Stanford. But more importantly, being in California and being born and raised in Miami Beach, Florida, I see the amazing increase in skin cancer and sun-related damages. And so that's what brought me to dermatology. So I came to San Diego in 1986. I joined a really nice guy named Richard Fitzpatrick, who had a passion for lasers and technologies. And basically, Fitz and I were able to just develop many different lasers and laser light and energy-based technologies for dermatology. During that process, we knew that we needed to do something to enhance laser light and energy-based technologies. And so Dr. Fitzpatrick and I, along with Dr. Kimberly Butterwick, started a company called Skin Medica. And we really wanted to use antioxidants and topical care in order to potentiate or improve the results that we were getting with other means. During the last 40 years, I've had the opportunity to consult with over 60 different skincare companies. And so I've developed a passion for skincare. And that's what leads me to Pavise. It's like, each skincare company tends to grow upon the shoulders of the last one. And now we have, I think, probably one of the most scientifically based skincare products around. But what's especially important is my wife really loves the products too. And so
always important.
And we could talk about that later, but not just my wife, but my patients as well. So it's the science, and the reason, as Chris said, every single patient needs to be on a skincare product. The very least is a sunscreen.
Very nice.
But if we can develop products or encourage our patients to use products that are scientifically based, we can really improve the lives of our patients. And Dr. Bowers and I know the reason we're doctors is because we want to improve our patients' lives and make them happier. And skincare is one way to do that.
So have you seen clinically that patients' outcome are improved because of the skincare products you recommend them to use?
Absolutely. Now, we were discussing last night, why doesn't every doctor recommend skincare products? And there are these silly little rules or suggestions by like the American Medical Association that says, oh, doctors shouldn't be recommending products because it means you have a financial interest. And I think that's just really archaic. You know, doctors are the best people to be able to recommend the appropriate skincare product. So I think it's the responsibility of doctors to ensure that our patients get the optimal skincare.
So I think Dr. Bowers will, think very similarly. I mean, you're one of the most beloved dermatologists in this country. So, tell the audience about yourself.
Well, I went to Texas A&M, and then I did my medical school in dermatology at UT Southwestern in Dallas. I've been out in practice about 26 years, and kind of like Mitch, I was kind of fairly early on as far as adopting the skincare. But when I went into dermatology, there was, just Botox was just starting to come out, very off-label. The hair laser, there just wasn't. It was like night and day from what we have now available in dermatology. So we went in it just because of the patients. I think, love seeing the diseases, because what's some of the things that happen internally, we also see externally. But a patient doesn't really tend to care or know they have high blood pressure or their kidney disease is somewhat elevated, but they notice that they've got red little spots here or vitiligo. It's very disruptive for their self-esteem, for their job, their personal relationships. So when we make patients better, not just cosmetically, like, oh, I look more like a magazine that's been photoshopped, but there's so many skin disorders that are really just, when we make them better, it's so powerful in their entire well-being. I think it's just been such a fun career, and I have even, a lot of pre-med and pre-physician extenders that come rotate through our practice. And I'm like, you guys, it's just such a blessing to be in medicine. Not just dermatology, but even though it's a different day, it's just a special bond that you develop with patients. But kind of going back to skincare. So I adopted probably one of our first products was just glycolic acid. And then we had vitamin C that was developed out of Duke that we started to incorporate as an antioxidant on our skin, and it was very successful. And then Skin Medica came out with their growth factors and things, and I was an early adopter of that technology. And so we have just seen this progression in skincare of using science to affect the skin and improve it, especially skin cancer type prevention. So that's, I think I feel very strongly like Mitch does, where dermatologists should be recommending the best things to put on our skin, because it's all science. At the end of the day, it's all science. I don't, in the early days, I think I agree, it was kind of archaic, where there's like the medical dermatologist and then there's the cosmetic, but I'm like, oh my goodness, it's just dermatology. That's right. Because it's all science that's being developed by very smart people like yourself, Sophie, in the lab at MIT and Harvard. And her story is quite impressive, having come over at age 16 to MIT out of China. I wish there was time for you guys to hear her whole story, but I'm sure it's on Pavise's website. But it's really quite the American dream, where you can come to America and use your brain and work hard and have grit and make a difference. So I love that part about you, Sophie. But in general, the new product that she's helped develop with the Pavise Diamond Core nanotechnology is really, for us, has been a game changer, because it's doing so many different things to the skin that we're all trying to do. Instead of it's doing more than I can even have 4 or 5 different bottles out there to do, but then it's all in one bottle. So just kind of a summary, that's kind of where I'm at. We've just seen the practice grow just we're in a suburb of Dallas Fort Worth, and that's kind of taken off, and we just, well, I love what I do, and I have great staff. I mean, I wouldn't have been able to do it without my staff that's been along with me through
You have
the way.
40 plus staff members,
We have about 40
right?
people now.
Yeah.
And started with 2 people. I didn't have any idea. I mean, this was not mapped out. It's just God sort of puts these things and paths in your way, and you just try to stay in your lane and do what's right by the patient, and then, it just comes back to you in tenfold. So.
Absolutely.
Yeah, Dr. Goldman, you mentioned last night that you have trained 48 fellows.
Yes, in the last 35 years, I've had the privilege of training a lot of fellows, 48 so far. But like Dr. Bowers, we have residents rotating through the clinic every single day. And then, like Dr. Bowers, we lecture to tens of thousands, if not hundreds of thousands of other doctors. So, we have a responsibility to do what's right, but we get, so much back in seeing our fellows and our residents and our fellow physicians continuing to advance our specialty. Because as Angie said, it's all about patient care and improving patient care. And for me, it's about inspiring happiness, both in our staff and our patients. I think the biggest advance that's occurred is in laser light and energy-based technologies. Number one, that's what's really put us at the forefront of rejuvenative medicine. I like to use the phrase the art and science of rejuvenation. That's what dermatology really is. And then with other products like skincare products, where we're actually diving into the immunologic mechanisms of fighting things like skin cancer or other skin diseases, that adds to it. So dermatology in the last 40 years or 26 years has really taken off, as most of medicine has. But dermatology is really at the forefront of innovation, I believe.
And have you seen a difference or shift in terms of what patients want from you, now versus 5 or 10 years ago?
Oh gosh. In that respect, I have seen a change. I kind of want to go back to 10 years ago.
Yeah.
I don't know if Mitch thinks the same.
I agree.
2015?
Well, I just kind of say that in jest, but I think in today's world, there's just too much outside influence where patients are real easily maneuvered by marketing, their social media, the influencers that are getting paid to talk about certain things. And they come in and they're doing this or that, or they've been on a cruise ship and they've gotten this whole skincare line. You're like, oh my gosh, you just spent $1,000 when I could get you really more productive products for a lot less. So patients are impatient now. They were called patients, but they're not impatient. They're now impatient.
Yeah.
And so I think there's a real trend where we try to be on time, which is good. I mean, in the old days, it might be 45 minutes, but they're on their iPhone and they can check their emails and everything now while they're waiting on us. So that part's been helpful. But it's just a lot of that mindset of we want it fixed now, and we can't always just fix things now. And it's still the art of medicine. It's not black and white. It's still very gray, even with computers and software and as much knowledge as we have. I think AI is going to make us more effective. It's not going to replace us. We're just going to use those tools, which we already do. I mean, we use it daily to just be a lot more efficient in what we're trying to maybe look up or put, drug side effects, that sort of thing.
So how do you, I guess, differentiate real science versus, as you said, misinformation or just marketing BS out there?
Well, the problem is, as both of you have just said, the marketing BS and the influencers are really a danger to all of medicine, not just dermatology. And that's why it takes a board-certified dermatologist and dermatologic surgeon to be able to sift through all of that BS that's out there to provide our patients with accurate information. We don't sell products. we recommend what's best for the individual patient. And it's not like a cookie cutter. It's not like every patient gets product A and B and C. It's our job to choose the optimal products to get the optimal care at the best cost to our patients. Because as Angie said, it's like we can save patients hundreds, if not thousands of dollars by focusing them on what is real, not just what is like a make-believe.
And what do you think skincare is going to go in terms of to help you to fill the need of your patients? What do you want to see coming out?
Gosh, that's right. I think Pavise has already kind of started that trend, quite honestly, where there's a lot of active ingredients in one particle, but it's actually doing new things. So we feel like there may be some new data that's going to help prevent skin cancer or help kind of those precancerous type lesions, which would be phenomenal. Because certainly in Texas and then here in San Diego, we just see skin cancer all day. So
even for your cosmetic patients, they are probably the skin
Absolutely.
cancer patients.
Absolutely. And
Yeah.
if we combined scientifically proven skincare with appropriate laser light and energy-based technologies, we potentiate everything. So I look for skincare companies in helping us with the other procedures we do make our work even better.
Yeah, absolutely. So that's where we've just seen this whole paradigm change with the modalities we can use to kind of micro injure our skin. Because at the end of the day, what I tell my patients is that we're just trying to injure our skin because our skin knows how to repair. When it's repairing, it's generally making it healthier. So we're trying to do it in just a very controlled way where we're doing micro injuries, just doing enough stimulation to help that process, and then with the products have a more robust response.
So the scientific way is we're waking up senescent fibroblasts.
Yeah.
So, by the time you reach age 70, only half of my fibroblasts are actually working. And the fibroblast is the cell that makes collagen and elastic fibers and hyaluronic acid. So as Angie said, we have to produce a mild injury to trick the fibroblasts into going, whoa, there's an injury, let's wake up again. And we can do it with laser light and energy-based technologies and products like Sculptra, different types of biostimulatories. And we can also do it with topical. So it's the combination, I think, that is really going to be the home run for the future. Again, it's not making people look different or fake. It's rejuvenating them. It's this whole part of rejuvenative medicine, which I think is the future.
What I was drawn to you guys early on was you guys are extremely scientific. Like all you care about is science. You don't care about marketing. You don't care about anything else. And I remember when I presented Pavise to you guys, each of you tested on yourself. I remember you did a laser on yourself, Fraxel, and then you immediately put Pavise on, and you immediately went cycling in San Diego. Would you recommend?
Right?
Would you recommend your patient to do that?
I tell the patient, hey, that's what I did.
Yeah.
And I still have a face, and but yes, that's okay. When I look at a new product,
Yeah.
I really want to test it.
Yeah.
And I want to test it out on myself and the next person that I love so much in the world, my wife.
Yeah.
Okay, maybe I won't test it on my grandkids, but if my wife and I love the product, I know that there's an incredibly good possibility or probability that all of my patients will like it too. And then I get to tell the patients, hey, this is a product I use. This is a product my wife uses. And I think that says something.
Yeah, for sure. And I tell them we have access to all the different products. So we could use whatever we want to use, but this is kind of what, at the end of the day, this is what I travel with. This is what I want to make sure I get on my skin every day, and that usually, it goes. Thankfully, they still trust us. But I think in our clinic, we make sure we're always doing kind of comparison, because you'll have so many companies give you this before and after pictures, and they all look great. And especially now with AI, they're not going to just give us a Photoshop before and after. We hope these companies that are coming out with things, but we'll do our own where we'll do like one hand and we'll do a fractionated type of thing, and then we'll have this product afterwards to see if it improves versus this one, or no laser, but we'll try to do some comparison half faces, and that really says a lot when we can do a half face and we apply one product here, a different product here that they're trying to compete with, and we may have 5 patients or staff members in a row do this, and then we really tell and then feel good about recommending that product to a patient.
As you said, rejuvenation or regenerative medicine is what people are really talking about these days. People don't want to look drastically different. They don't want to look like a blown up doll. They want to look at themselves, but maybe like shave 5 to 10 years off, right, their face. And science has been evolving incredibly as well, and I think that's where our specialty come in. Is we are studying the biomarkers not in vitro but on actually skin biopsies, right? We developed a whole new method to do that on skin, which we can study the fibroblast in intact skin tissue. We can study P53, P16, TF1 beta, all of those amazing biomarkers we all know now that is very intertwined and important when we talk about aging, right? Skin aging, where all symptoms we're thinking about inflammatory skin conditions, that every patient has some sort of rosacea, melasma, or even like eczema, psoriasis. And that's how we develop Diamond Core, right? We want to biologically fix the problem at the root cause, and if we can do that with one product or one step, we don't want to try to do it with like 20, 30, 50 steps. And I think that really plays well with what you're seeing in clinic, that you see the science making sense and then you use it in your clinic, that you see patients have seen these drastic results that can be provided by the topical products, and that drastically improve the patient outcome.
Yes.
So I just want to mention to our viewers that if you can hear the sound of fighter jets going overhead, the F-18s and F-35s, it's the sound of freedom.
That's
we
right.
have the Miramar Air Base, Naval Air Base is right over here, and so I apologize on behalf of our service, armed forces, but unfortunately we're hearing some of that. But I was wondering if I could ask a question.
Yeah.
So Chris, you've been in this industry for a long time, and you've seen skincare companies come and go. What's your impression of how skincare is evolving?
That's a great question, because it's the Wild West. There's, I would say, estimated about 26,000 skincare lines in the U.S.
Wow.
I mean, even J-Lo has a skincare line we were talking about last night. And so what do you do to separate yourself? And I think proving it is becoming the pinnacle, or the barrier of entry into dermatology is to put your money where your mouth is. And that's an IRB approved, placebo controlled, multi-center study, right? Those are studies that you do all the time, and so do you. And really that's what the Aesthetic Research Committee was really formed to try to do, to formalize, because you can get lost in marketing. You can get lost in influencers. What's hot now, what's good now is not necessarily true. And so I think what I've seen is a development over the years where skincare has to cross these barriers and these bars, and really to be in this space is really hard, because you guys do take it so seriously. And not only do you put it on yourselves and your family so it's personal, but your basic oath is to not do any harm. And so you have to be convinced, because skincare does not sell itself. Skincare is very difficult, especially physician dispensed skincare, because to your point, they're inundated with ads and specials and promos, but when they come to a dermatologist, they expect to lead with a skincare product or two, and it's up to you guys to set that bar very high on what you're going to recommend to your patients. And that's what I feel like is changed, is skincare is not just one category. It's very, very segmented, in dermatology is the highest level of that. So I think just, you think about where you started with Skin Medica years ago to what being launched today from MIT and Harvard, like it's pretty cool.
So, like Skin Medica has really built a foundation in terms of what clinical validation should look like. Right, because I think before Skin Medica, there weren't brands at all were doing the type of clinical studies or research or validation of proofs. of any of the claims that they were making.
I guess SkinCeuticals was the closest one, because it was always like we were always against SkinCeuticals and who was going to be better. And okay, Pinnell did a really great job on antioxidants. We did a good job on growth factors and exosomes. But I think you're absolutely right. It's like over the last few years, it's just gotten better and better. But out of the 2,000 skincare companies, or how many there are less than a handful that are actually doing the research that you are doing, and SkinMedica and a few others are doing to prove and validate the science behind their products.
Yeah.
You got to earn it to be here, and that's how you do it.
We have spent about $10 million in R&D alone just to prove it.
Yeah, wow.
Yeah.
And I think just even speaking to the magic bullet again, I mean, that was kind of new data for me. I think our other physicians would be very interested to kind of understand how it's affecting the cells that are cancerous to make them become apoptotic, and versus our normal cells it's not affecting. So that this new nano diamond core technology is starting to do that. And then we're going to, we just are on the cusp of just so much new innovation, both for our internal cancers, and then we're starting to see it for our topical skin cancers.
Yeah, if you think about how GLP-1 has basically changed the world, we're definitely going to see more of innovations coming out for dermatology, for every aspect of healthcare. And that's what science is about, right? Science is basically you might have to accumulate knowledge or making step functional changes for over a couple decades, and all of a sudden build up to the point where you can actually have this step-wise change that that people can actually see the benefits. And that's where we try to be. We try to be the step functional change, trying to actually create new molecules, new technologies, to do the things that traditionally has been the unthinkables or impossibles to do. And we're just very lucky to have pioneers like you to help us develop those things in a true clinical setting to generate serious health outcomes for patients out there. So the last question I have for both of you, because you guys are extremely successful and many of our audience are dermatologists, especially the younger ones, that they want to know, over the course of your career, given what you know now today, what happened that have you had a mindset change to become successful the way you are versus a lot of possibly that your peers are not as successful running the practice as you are?
A difficult question. I'll take it
That's
first, Ann,
loaded.
as you're thinking about the answer. For me personally, it's about inspiring happiness. When my patients are happy, it makes me happy. And I think we all have a purpose in this life that we're living on this planet. And I want to be remembered as someone that made people happy. Now, selfishly, I'm getting old and my skin is starting to get wrinkled. And so I want to be on that cutting edge, because even though I'm 70, I still think I'm like 30. And
Your brain is definitely about a 30-year-old, that's for sure.
But I don't want to look. I don't want to look as old anymore. I still have another at least 10, 20 years. I can make more people happy. So I'm counting on people like you and your colleagues to make life better for us, to make us look as good as we feel.
I think it's all very relational. What we're in, we're not drawn to dermatology if we're introverted, because we just see a lot of patients every day and we have to kind of develop that rapport. We're gonna still try to offer, like we talked earlier, the best product for the patient, but we want to be in control of what they're putting on their skin. Because I cannot tell you how many times patients come in and they've had facials done somewhere, or they're just experimenting because of what they've seen on the internet, and they're just all red and they've had allergic contact dermatitis from it. So when we recommend the products, we tend to have a little less of that occurring.
So we're talking about happiness. So Dr. Goldman, last night you talked about when you're 40 years old, you were still living paycheck to paycheck and paying off student loans. So
True.
because a lot of the younger derm that they look up to you guys being so successful, in every single aspect, and they want to be like you. But they don't necessarily see the hardship or the hard work or the difficult times.
I've never worked a day in my life. I love what I do, and I love making people happy, and I try to instill upon the next generation, you have to love what you do. And that's the important part of what we're doing. And so those first 40 years, or actually the first 10 years of being a dermatologist and living paycheck to paycheck and trying to raise two young kids, it's tough, as Angie knows, as a mom, which is even tougher because it's the moms that do most of the work. But I didn't feel it. It's like I didn't feel it. In my personal life, I just got very lucky. I developed a few lasers, and all of a sudden, I had money in the bank. But like Fitzpatrick and I would always take any money we had, and we would put it to more research to develop more things. It's our passion. So I think the other word we can use besides happiness is passion. You have to be passionate about what you're doing too, and then you don't work. You just live life to the fullest.
So you just need to find your own lane. We're not trying to be a copycat of these different people, but we all have different strengths. So trying to use that to our advantage and feel like you're making a difference. And it's obviously, we're going to say it's not about money, because I can tell you that certainly I'm not any really happier now having extra income. It's easier in ways of navigating some of the adulting of life and getting an airplane ticket or whatever it might be. But the core inner peace and joy that I have is not different now than it was when I'm in medical school learning to do these things and had nothing. And I even learned how to change my own oil in my car, because I would save a lot of money doing that. So it's just kind of really listening and kind of hearing what are my strengths, and then following that, and then success comes. And not just financial success, but success that you're making a difference, like you have done, coming to America and inventing this amazing product out of all the research. Because I know you tried a lot of different molecules.
Yes.
You spent a lot of sleepless nights in the lab as well.
I like how you guys talk about how money makes things easier but doesn't make you happier. I really like that phrase to put things into perspective. So Chris, if you were to conclude thinking about you have the two true leaders in your group, what you see the common denominator between those two that make them such inspiring leaders, not just for platinum doctors, but for all the doctors out there?
Yeah, they're two great examples, and I think that's one of the reasons coming into platinum from the industry side, so coming over to the practice side, they actually both interviewed me or recruited me, however you want to look at it. But really, at the end of the day, what we wanted to do with me coming to this was, I'm not a physician. I don't pretend to be. I don't ever talk like I am. But what I can do is build a vehicle for these two thought leaders to help lead our entire organization, which is what's needed right now. We have 125 locations, almost 400 providers. How do you come to a consensus? How does everyone come to the conclusion that this is the best product for my patients? Is listening to voices like them plus 7 others, so there's 9 in our aesthetic research committee. But really, you would think when we go into those that you think about price or money, and to your point, that's not what either of them thought. We allowed them to vote on how do we want to make decisions as a company. The number one way was product portfolio and innovation. Again, that's probably why you're sitting here. Number 2 was research. Number 3 was pricing. Then marketing support was rounded out the top 5. And just settling on those and living by that code helps to be the example for the other providers, not only in our group, but hopefully outside of dermatology. To this point, they have reach on podium at meetings and fellowships. They're guiding the future of dermatology. So really kind of figuring out what's important and then coming together as a group is what I came here to do and drive that vehicle. And I would say I'm really proud to be sitting next to both of these two.
Yeah, I'm certainly, as a patient point of view, feel incredibly lucky to have doctors like you guys
Right.
to be the doctors like for all the people out there, right? It's an incredible privilege for people like me, knowing that when I'm in need, I can get the best care out there from people like you. And I think that's, always thinking about count your blessings, and definitely feel like knowing you guys, not just as research partners, collaborators, but truly just, as physicians, like somebody that I would go seek care for. It truly is, has been such a wonderful, fortune for me to have. So I just want to, say thank you for everything you have done throughout the decades and inspiring generations of doctors, in this country and also, internationally to, make this world a better place and to make people healthier and happier.
Well, it's a privilege being here. Thank you,
Yes,
Sophie.
absolutely. Thank you.